Hello, my name is Lauren Williams, and this summer I'm interning with the Washoe County Health District by supporting the Washoe County Behavioral Health Policy Board to identify gaps in behavioral health service delivery in the region. During the previous legislative session, Assembly Bill number 366 was passed, which divided Nevada into 4 behavioral health regions: the Northern, Washoe, Rural, and Southern region, and designated a policy board for the respective area. Each policy board works to identify gaps in behavioral health service delivery, provide any recommendations or service enhancements to address those gaps, coordinates with other policy boards to provide unified recommendations. It may request the drafting of one legislative measure relating to matters within the scope of the policy board. There are 3 components to my internship. The first was the development of the Washoe County Region Behavioral Health Profile. I then presented this profile at 3 community meetings. And lastly, I captured the public's perception of gaps in behavioral health services.
The major work product of my internship is the Washoe Region Behavioral Health Profile, which is a compilation of substance use and mental health data that highlights trends, prevalence rates, and provides county, state, and national comparisons of relevant data. Both Competency 1, assessing population needs, assets, and capabilities that affect communities' health, and Competency 2, selecting quantitative and qualitative data collection methods appropriate for a given public health context, were achieved in the development of the profile. The profile is designed to support the policy board in identifying gaps in Washoe County's behavioral health service delivery system and to be easily interpreted by the general public. Methods that I am employing to increase understanding of the information presented is to make the report interactive by highlighting areas of concern and to use plain language when interpreting the tables and figures. Additionally, I am working on a template that can be used annually for updating this profile. The template includes information on where to access the data source, information to add in the future, and notes to the specific method of data collection. The next component of my internship addressed Competency 4. Communicating audience-appropriate public health content both in writing and through oral communication. During the month of July, I presented the profile findings to 3 different audiences: the Northern Nevada Behavioral Health Coalition, the Children's Mental Health Consortium, and at the Washoe Regional Behavioral Health Policy Board meeting. I tailored each presentation to the focus of the respective audience.
Gaps in services, places where they might want to put some attention, especially with their bill drop requests.
At a Behavioral Health Coalition and the Children's Mental Health Consortium presentations, the audience engaged in a discussion that captured the public's perception of gaps in the behavioral health services. Following the Northern Nevada Behavioral Health Coalition and the Children's Mental Health Consortium presentations, the audience engaged in a discussion that captured the public's perception of gaps in behavioral health services and how they feel the profile represents their experiences. Facilitating a community discussion on the strengths, challenges, and ideas for improvement of service delivery in Washoe County indicates achievement of Competency 3, applying negotiation and mediation skills to address organizational and community challenges. Competency 5, performing effectively on interprofessional teams, has ran throughout my internship. I've worked closely with Heather Curran, who specializes in qualitative and quantitative research related to the field of public health, as she has supervised the development of the profile. I've had multiple conversations with the director of the Office of Suicide Prevention and the director of Join Together Northern Nevada to discuss profile findings and gain a deeper understanding of the trends. Competency 6, interpreting the results of data analysis for public health research, policy, or practice, was addressed by using the profile as a tool to help the board prioritize the needs of the region. The importance of this project is to influence the discussion of behavioral health among community members and to clearly identify areas where action needs to be taken.